yet.
Veamos ahora. Tenemos dos lecciones, vamos a dividirlas. Can you see my screen, así?
It started,
Yeah,
yes.
well, let's
Now.
begin with the lesson. Comencemos. Vamos a empezar con un vocabulary, ¿ok? Porque no podemos hacer el libro, es que no sabemos palabras que tienen que ver con la medicina, medicine, ¿ok? La primera palabra es excerpt.
Ex-
Excerpt significa fragmento, extracto de un texto, ¿ok? Please,
okay.
Jimmy, read the example.
My autography has just been published. Allow me to read you an excerpt.
Yes, published. We say published, okay? And they will say me autobiography has just been published. Allow me to read you an excerpt. Mi autobiografía se acaba de publicar. Déjame que te lea un pasaje, un extracto. ¿Se entiende el concepto de excerpt? Yes?
Yeah. Mhm.
Denise, please read the second one.
Yes.
Diagnose somebody with something. Read the example. They.
Me.
Yes, you.
And they diagnosed her with attention deficit disorder.
Yes. You diagnose somebody with something. You can say, well, I was diagnosed with cavities. You see my point here?
Yeah.
Diagnose somebody with something. She was diagnosed with cancer. Fue diagnosticada con la enfermedad. Then we have the word staff. Empleados o personal. ¿Se entiende, cierto? Any questions about these words? No, right? Then we have next one. Gum. Gum means?
No, it's diagnose.
Yes, diagnose. Then we have gum. Do you know? Encías, right? Encías. Please, Jimmy, read the example.
The dentist told Mary that she needed to floss more to take care of her gums.
Yes, what is floss?
To floss, move,
Nope. Usar el.
extract.
Usar el hilo.
Okay. Dental.
The dental floss. Cuando compramos el dental floss,
Okay.
floss, ya es pasarse el hilo dental. Okay? Next, toward or towards is a preposition. Okay, please read the example. Means para. Can you read it? Nope. Okay, I'll do it.
We can hear you, Dennis. Your microphone is on, but I can hear you.
Yeah, me neither.
I put a bit of money away toward my summer holiday.
Yes, it's like for. Es como decir un for, pero ya no digan for, pueden decir toward, towards. ¿Quedó claro? Yes. So then we have the word examine. Examine. Examinar, revisar, todo lo que tenga que ver con la salud. Okay? You can say, I need to examine my teeth, my eye, my condition, my physical condition. Okay? And then we have the adjective underpaid. Underpaid, mal pagado, quiere decir que no ha recibido el suficiente dinero. ¿Alguna consulta? Do you have any questions up to this point?
No, it's clear.
Clear. Well, let's begin with this part. The first unit, dentistry. Okay, so before you read the passage, talk about these questions, okay? Jimmy, what does a dentist do?
What are the dentists do? In the pictures or
No,
in general?
general, your idea.
My idea is maybe it's a resume of the career, no? For example, what is the way of no, yes. What is the sport that the dentist works every day? Maybe what is the process of their works? No, yes, a little concepts of about this
Okay,
in
cool.
the journal.
Yes, yes. Denise, why are dentists important?
Because we treat people that they have some oral disorders, and
Okay.
we need to examine all the oral system that they have
Uh huh.
and do some treatments, such as the cavities, losing teeth, and what else?
Okay, cool.
Gut disease.
Cool. Can you see the picture here? Up here? Dentistry, then we have a license. Una licencia. So please, Jimmy, read this part. A dentist's job.
Okay. Dentists deal with the oral health of patients. Oral health includes the teeth, gums, and other structures of mouth. Dentists diagnose and treat related medical issues. They give instruction on tooth and gum care. They offer advice on decisions impact oral health.
Yes, focus on this part. Deal with. Deal with. Dentists deal with something, ¿ok? Tratan con, deal with también es lidiar, pero tratar con oral health, la salud
Oral.
oral, ¿ok? Aquí tenemos diagnose, que ya vimos que en el pasado, diagnose with. Tenemos give instructions on. Recuerda que dientes, ¿cómo se dice dientes?
Teeth.
Tell me, teeth. ¿Y diente?
Teeth.
Teeth.
Tooth.
Tooth. Muy bien. Gum and see. So we have tooth care and they offer advice on. Offer advice on decisions impacting the oral health. Okay? Please, Denise, read how to become a dentist. Are you there?
Then is your microphone
Okay.
is
How to become a dentist? Dentists must earn a college and professional degree. They also need a license from the state.
They also need a license. You cannot work if you don't have a license. Okay? And of course,
License.
a professional degree. Okay? Two steps. Next, Jimmy, read the workplace.
dentists may work alone or share a practice. They often employ support staff.
Yes. Support staff. Ya sabemos que es support staff. And then we have Denise, please. Prospects.
The dental industry is growing. And jobs should increase by 21% during the next decade. This is
During
a
the next
response
decade.
to the next decade, and this is the response to greater public demand.
Okay, to greater public demand. Interesting. Next. Reading. I have a question. What is the purpose of the excerpt that you just have read?
Mm,
Which
in
one?
my own words, show the general concepts, no, the general definitions about the professional practice of the dentist.
Okay, it would be letter A, B, C, or D.
Describe recent change, explain importance of defense since the A.
To provide details about a profession. Good. Denise, you, or maybe you, Jimmy, what can be inferred about dentist?
Mm, I don't get it the questions.
What can be inferred?
Infer.
Inferido. Yes.
Infer. Dentists in group practice are more successful. License rules are the same in the most states. Dentists are currently unpaid of their work. Dentists should have an easy time finding jobs. Blah, 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 blah.
For example, dentists should have.
Licenses,
Tell me.
licenses, B.
Licenses rule for
According to
dentists.
the
License rules.
Yes,
according
because
to the text,
according to the text, we need a license. You cannot work if you don't have one of them. This is letter A, this is letter
basically,
B. What,
basically.
what about here? Which of the following dentists do not do? Treat
Not
problems with gum? Okay, the dentist, do dentists treat problems with gum? With gums? Sure. Do
yes,
dentists practice on support staff?
yes.
Okay, diagnose medical issues? Teach patients about the oral care? Yeah, what about here?
Maybe B because
Yeah,
it's a diagnosis medical issues is all different issues, no?
it's the body, the whole
Right.
body.
Es general.
It's
Uh-huh.
general, amazing. Now let's come back here. Dentist is the professional, the person. The oral here related to the mouth. Diagnose, the verb, the practice, instruction, and professional. Okay, so Jimmy, please, number one, read and complete.
The woman was working toward earning earning mm, what is earning?
Earning, ganar.
Okay.
Ear money.
Um, professional degree in
Professional
dentistry.
degree. Professional degree. Título profesional. Number two, Denise,
The dentist examined the patient teeth and gums.
the dentist. Next, Jimmy, number three.
Several dentists work together in a group practice.
In a group practice. Number four, Denise.
The dentist diagnosed the patient with gum disease.
The dentist diagnosed a patient, yes.
Is diagnosed,
Diagnosed, yes.
not diagnosed.
Number five, Jamie.
Regular teeth cleaning is vital to good oral health.
Yes, is vital. It's vital,
Right.
vital, importante, oral health. Number six, Denise.
The dentist provided instruction to her patients on the correct way to floss.
Yes. Recuerda que dar instrucciones sobre algo es to provide, to give instructions to somebody on something. ¿Ok? Por ejemplo, ¿cómo dirías? El nutricionista me dio instrucciones sobre mi alimentación. ¿Cómo dirías eso, Jimmy?
The nutritionist provide me instructions to
No, provide instructions
provide instructions to me
on
to me on the best behavior. Feeding behavior.
yes, the eating habits, on my
Right.
eating habits. Did you understand this expression? Provide to give instructions to somebody on something. ¿Se entiende? Yeah? No questions,
Yes, it's a
Denise?
formal way to use give.
Yes, okay. Es como decir, el doctor me indica que tengo que hacer esto. Entonces, the doctor gave me, no, sorry, the doctor gave me or gave instructions to me on how I can eat, how I can take care of my body, how I have to eat, sobre cómo debo de comer. You see my point here? To provide, to give instructions to somebody on doing something. Okay? Nice. Next part. Okay, write the word that is similar in meaning to the underlined part. Please, Jimmy, read the first one and tell me the word.
The woman wanted to get a professional degree in a medical study of the mouth and teeth.
This is
Dentist.
dentist,
These two.
dentistry, dentistry.
Dentistry. Okay,
Yes.
dentist.
Okay. Es como decir odontología. Okay.
Ah,
El estudio de la boca y de los dientes. Next. Denise, please read number 2.
The dentist needed a special document giving her the right to work in a certain field.
Yes.
License.
Yes. License. Number 3, Jimmy.
The dentist gave the patient his opinion about what to do.
What is that?
Mm, mm, uh, no, it's instructions? No, his
No.
opinion.
Yes.
Do
you remember?
Diagnosis? No.
Diagnosis? Nope.
No.
Look at the reading part here. They offer
Advice.
advice, of course. Ahora, Carlos, pero advice no es consejo. Sí, pero es de un profesional también,
Yeah.
¿ok? No es que el doctor, el nutricionista, el odontólogo, el oftalte te dé consejos, sino te dan con fundamento. Number 4, Denise.
The mouth and teeth can provide information about the patient's physical condition.
Yeah, physical condition? Health. Easy peasy lemon squeezy. Did you understand this part?
Yes.
Yes. So now you are going to listen and read the occupational guide excerpt again. Who else might a dentist work with? Listen to the question. Who else might a dentist work with? Okay? Do you understand the question before I play the audio?
Who else might a dentist work with? ¿Quién más podría trabajar como dentista?
Con un dentista.
¿Con
¿Quién
quién
más?
podría trabajar el
Con
dentista?
un dentista.
Yes.
Ok.
O un dentista con quien más podría trabajar. Okay?
Okay.
Let me a minute. Give me a minute, sorry. Nope.
Yeah.
Again. Now, can you listen? It's loud in, I think. Let me change the quality. Now, I think you can.
Dentistry by Virginia Evans, Jenny Dooley, and James Caldwell, DDS. Copyright Express Publishing. All rights reserved. Book 1. Unit 1. Dentistry. Exercise 5, page 5.
Dentistry, a dentist's job. Dentists deal with the oral health of patients. Oral health includes the teeth, gums, and other structures of mouth. Dentists diagnose and treat related medical issues. They give instruction on tooth and gum care. They offer advice on decisions impacting oral health. How to become a dentist? Dentists must earn a college and a professional degree. They also need a license from the state. Workplace. Dentists may work alone or share a practice. They often employ support staff. Prospects. The dental industry is growing. Jobs should increase by 21% during the next decade. This is in response to greater public demand.
Exercises 6 and 7, page 5.
So why are you interested in joining our practice?
I heard you were looking for another partner, and I am an experienced dentist.
Can you tell me about your background?
Well, I worked as an associate dentist for 2 years. Then I had my own practice for 4 years.
Why did you discontinue your practice?
My wife got transferred here from out of state.
Okay. Do you have a professional license for this state?
I do.
Unit 2. Specializations. Exercise 5.
Okay, did you understand?
Yeah.
Okay, so the question is, Dennis or Jimmy, who else might a dentist work with? Do you know?
A dentist can work alone, but sometimes with associated partner.
Association, like with another partner. Okay? Okay, cool. Now, listen to the conversation between the interviewer and the dentist and make the sentences true or false. My question is, the dental practice is hiring support staff?
Yes.
True? Yes. The man has 6 years of relevant experience?
Mm,
No.
Nope.
no.
The man
False.
has a required license?
Yes.
Cool. We're done with that part. Next, listen again and complete the conversation. So I want you to take a screenshot. Okay, you have the screenshot?
Moment.
Yes, and you are going to complete. You got it?
Okay.
Denise, you have the screenshot?
Yes.
Good. Let's listen again.
Support staff. They also need decisions and structures of dentistry, a dentist's job. Dentists deal with the oral health of patients. Oral health includes the teeth, gums, and other structures of mouth. Dentists diagnose and treat related medical issues. They give instruction on tooth and gum care. They offer advice on decisions impacting oral health. How to become a dentist. Dentists must earn a college and a professional degree. They also need a license from the state. Workplace. Dentists may work alone or share a practice. They often employ support staff. Prospects. The dental industry is growing. Jobs should increase by 21% during the next decade. This is in response to greater public demand.
Exercises 6 and 7, page 5.
So why are you interested in joining our practice?
I heard you were looking for another partner, and I am an experienced dentist.
Can you tell me about your background?
Well, I worked as an associate dentist for 2 years. Then I had my own practice for 4 years.
Why did you discontinue your practice?
My wife got transferred here from out of state.
Okay. Do you have a professional license for this state?
I do.
Unit 2, Specializations. Exercise 5.
Okay. So, can you see my screen, right? So, why are you interested in? Do you know the answer? Why are you interested in?
Join.
Joining. What else?
Joining our practice.
Our practice. I heard you were looking for another.
Partner.
No. Number 3.
No.
Listen, number 2, number 3. But we want some.
Professional.
Okay, can you tell me about your background? Well, I worked as an associated dentist for 2 years. Why did you?
Discontinues your
Discontinue
practice.
your practice.
Practice. My wife got transferred here from.
Out of the state.
Another state.
Okay, number 6.
Okay. Do you have
License.
license?
A license for. Okay, so
License.
you are gonna listen again, but just these parts and check your answers with me. Okay, so let me play the audio again.
Okay. Do you have a
2 years.
our practice?
Greater public demand. Prospects. State. Health. Dentists diagnose and become a dentist. Work alone or during the next decade. This is in response to greater.
I heard you were looking for another partner, and I.
Exercises 6 and 7, page 5.
So why are you interested in joining our practice?
I heard you were looking for another partner, and I am an experienced dentist.
Can you tell me about your background?
Well, I worked as an associate dentist for 2 years. Then I had my own practice for 4 years.
Why did you discontinue your practice?
My wife got transferred here from out of state.
Okay. Do you have a professional license for this state?
I do.
Okay, so the last one,
Unit 2,
professional
Specializations.
license. Okay.
Exercise 5,
Professional
page
license.
7.
Okay, that was great. So now what I want you to do is to read. Okay, so Jimmy, you are the interviewer, and Denise, you are the dentist. Please read.
Okay. So why are you interested?
Repite conmigo, interested.
Interested.
Ya,
Okay.
ahora de
So
nuevo.
why are you interested in join?
No, mira, listen. Why are you interested in? Interested. ¿Te toca?
Okay. So why are you interested in
In what?
join?
Joining. Recuerda que después de las preposiciones los verbos vas con ing. Joining
In joining
our practice.
our practice?
I heard you were looking for another partner, and I'm an experienced dentist.
We are, but we want someone. Someone I don't remember what.
Do you
what
remember
part.
Denise?
With experience? I don't know.
But we say
Okay.
wire.
We want someone with experience.
Yes.
With
With experience. Can you tell me about your background?
Well, I worked as an associate dentist for 2
Associate.
years.
Repite conmigo. Associate.
Associate
No.
dentist for
Associated. Well, in this case, an associate.
associate dentist for 2 years. Then I had my own practice for 4 years.
Why did you discontinue your practice?
My wife got transferred here from out of the state.
Okay. Do you have a professional license for this state?
I do.
Ahora intercambiemos. Okay? Okay?
So
Yes.
were you interested in joining our practice?
No. Igual que Jimmy, no es interested, sino interested.
Interested.
Yeah, ahora más fluido. So, why are you interested in joining our practice?
So why are you interested in joining our practice?
I heard you were looking for another partner, and I am an experienced dentist.
We aren't, but we want someone with experience. Can you tell me about your background?
Well, I worked as an associate dentist for 2 years. Then I had my own practice for 4 years.
Why did you discontinue your practice?
My wife got transferred here from out of the state.
Okay, do you have a professional license for this state?
I do.
I do. Amazing. Okay? Good. Let's continue. Speaking part.
Interest, ¿no? Interest.
Por ejemplo, interés se pronuncia así, mira. Interest, interest, interesante, interesting, interesting, interesado, interesada, interested, interested, ¿ok? Ahora, interested es interesado, pero no es como interesado de que el dinero, cosas así, ¿ok? Sino es que tiene ánimos de gustarle algo. Pero agrégale la D a ese interested, agrégale interested.
Interested, interested.
Interested in. Aquí sería, mira, esta D se encuentra, acá se pronuncia así, mira. Dame un segundo, please, sería así. Interested, así. Pero esa D se encuentra entre dos sonidos de vocales. Entre la N y el que sería interested in. Interested in. Es como decir expert.
Interested in.
Por ejemplo, expert in, la T se encuentra entre la R vocal, borro, expert in. Un experto en algo, expert in. Por ejemplo, yo puedo decir, I am an expert in, y dices, no sé, prosthetics, or you use another one. Okay, so with the partner, act out the rules below based on task 7. Puedes decir, do you have, I work as, can you tell me? Okay, But we're going to skip that part porque ya la practicamos aquí. ¿Tienen alguna consulta sobre una palabra aquí? No, right?
No.
Mason. Next part, you have a writing. Use the excerpt. ¿Qué cosa era excerpt?
Pedazo.
Un
Passage.
extracto. Ok, un pasaje de algún texto. Use the excerpt and the conversation from the task A. Aquí, la que ustedes van a hacer, of course. And to fill the job positions. Ok, dice dentist wanted. Según el audio, ok, ¿qué tipo de requerimientos necesitaba? Job details. How many years of experience? 6
years.
or
Professional license.
okay, professional license. But this is a job detail or a requirement?
No requirement.
Yes, the workplace. ¿Dónde iban a trabajar? Do you remember? Let's come back. Let's come back. You took a screenshot. Where?
Where?
Look at this. Dice, an associate dentist for 2 years. Then why did you discontinue as your practice my legal transfer? So we have blah, blah, blah. Okay, but you were supposed to create your own. Ustedes tienen que crear su propia conversación, pero por motivos de tiempo vamos a saltear esa parte, ¿vale? ¿Les parece? ¿Pero qué es job details? Job details. Cuando tú veas en algún enunciado job details, es lo que vas a hacer en el trabajo, ¿ok? Yes. Los requirements son lo que van a necesitar para que te contraten. A license, a professional degree. ¿Y se han dado cuenta cómo se dice en inglés obtener un título profesional? ¿Qué verbo? Earn, muy bien, que es como ganar. Earn. ¿Ok? Podemos usar earn o get. Cualquiera de los dos. ¿Ok? Yes. Next. Workplace es el lugar. ¿Ok? The workplace.
The clinic.
Ok. En lugar de decir clinic decimos operatory. Ahorita vas a ver por qué. ¿Ok? Sigamos con vocabulary. Please, we have the first word. Periodontics. Periodontics. ¿Qué cosa es periodontics? Please read, Jimmy.
Periodontics, the area of dentistry, the work of a dentist concerned with gums, the pink flesh in the mouth into which the teeth are fixed.
Yes, eso es.
And other tissues around the teeth.
Yes, ¿qué viene a ser periodontics en Spanish? Do you know?
Okay, the structure of the mouth when not have a teeth, no? For example, the tissues, tejidos, no? The tissues of the arms.
Ajá, yes, eso viene a ser periodontics. Okay? Periodontics is the area of dentistry, you know, odontología concerned with the gum. Tiene que ver con los encías. Okay, periodontics. Next, Denise, maxillofacial.
Maxillofacial. Relating to the mouth, jaw, face, and neck, or the medical treatment of this part of the body. The soft tissues of the maxillofacial region. My training is in maxillofacial surgery.
Yes, maxilofacial, que tiene que ver con qué? Con la boca. What is that? Do you know?
The jaw.
Yeah, but in Spanish, do you know the word?
Mandíbula.
Okay, then we have face. Neck. Then we have pediatrics. You, Jimmy, pediatrics.
The science of study of medical care for children.
Yes.
She specializes in pediatrics.
Specializes in pediatrics. Look at here. Especializarse en algo. Specialize. Le agrega la S. She specializes in pediatrics. Pediatrics. Presta atención aquí. Pediatrics in the US se escribe así. Pediatrics. But in the UK es así. Y se pronuncia igual, pediatrics. ¿Quedó claro?
Yes.
Maybe you are reading some books. Yeah, pediatrics. Then we have here endodontics. Is a branch of the dentistry, especialidad odontológica. Endodontics. Let's continue. More
Branch
words.
is rama, ¿no?
Branch, rama, perfect. Luego tenemos aquí, presten atención con estas palabras que encontramos en los libros. Referral. Referral could be referente, un paciente referido, pero también es una derivación. For example, my doctor gave me a referral to a surgeon. El doctor me dio una derivación a un cirujano. Es ese documento donde te dicen tienes que ir a tal para que te haga una tomografía. Es un referral. Pero también la persona viene a ser un referral. ¿Se entiende? Yes?
Sí.
Amazing. Next, then we have prosthodontics. Prosthodontics. Please, Jimmy, read.
The area of dentistry connect with replacing missing, damaged, or unattractive teeth. Now, implants have changed prosthodontics more than any other innovation in dentistry. All specialists in prosthodontics will have typically undertaken 3 years of specialist training.
Yes, ¿qué viene a ser prosthodontics? Todo lo que tiene que ver con reemplazar.
Replace.
Replace. Todo lo que tiene que ver con replace.
Sí.
Okay? Then we have the word toddler. Toddler es un niño de 1 a 2 años. No es un kid. Un kid es un poquito más. A toddler es un bebé. Oh. Uh-oh. Where is Denise? Okay, we have to wait for Denise. But because it's the same link. It's the same link. Yes, do you have any questions about the toddler?
No, prosthodontics.
Yes. Cuando veas una TH, pones la lengua entre los dientes y soplas. Mira.
Prosthodontics.
Yes. Yes. La próxima lección es Full Nutritionist. Ahora te voy a enseñar cómo es y me indicas si está relacionado a tu carrera, Jimmy, ¿ok?
Okay. No, this other
Other field. Yes, pero es importante. Es importante. ¿Ok? Al finalizar la lección te voy a mostrar para ver si tienes relación con lo que haces, ¿vale?
Yeah,
Okay. Ya lo tengo hecho. Ya lo tengo preparado. So, quiero enseñarte para que me digas. Sí, es por allí voy. ¿Ok? So, Denise, any questions about the toddler?
Total.
No.
Se pronuncia toddler. Toddler. Yep.
Toddler.
For example, your baby is a toddler or a kid?
He's a kid.
It's a kid because he's not a toddler. Yes,
He's
great.
3.
He's 3 years. Great. Okay, then we have this one. The root canal is a treatment for a tooth where the infected roots are removed and replaced by a hard substance. Que le ponen resina, creo, ¿cierto? What is the root canal?
Endodontic.
Yes, but in Spanish we call this endodoncia. Then we have pathology. Pathology. Patología. Okay, the researchers are studying the pathology. ¿Qué viene a ser pathology? Diseased. Otra palabra, injury. Injury viene a ser lesión. Ok. Siempre podemos decir knee injury, una lesión en la rodilla. Ok. Una lesión en el brazo. How do we call brazo in English? Mano?
Arm injury.
Arm injury. Ok. Next. Then we have gingivitis. What is gingivitis? Please read, Denise. Gingivitis.
An infection of the gums and the part of the mouth from which the teeth grow, which causes swelling, pain, and sometimes bleeding.
Bleeding, of course, when you are brushing your teeth. Gingivitis. ¿Puedes pronunciar, Denise? Pronuncia la palabra gingivitis en inglés.
Gingivitis.
No, gin.
Gingivitis.
Gingivitis.
Gingivitis. Gingivitis. Gingivitis. Gingivitis. Acuérdense esas palabras que ahorita vamos a ver. Okay, so number 2, specializations. Okay, guys, as you can see here, ya sabemos que es periodontics. What is periodontics? Do you remember?
Periodontic.
Periodontics, here, periodontics. Concerned with the gowns, todo lo que tiene que ver con encías. Maxillofacial, ¿con qué tiene que ver maxillofacial?
Related with the face, neck,
Related to the face, the mouth, the cheeks,
The jaw.
and the jaw. Luego tenemos pediatric dentistry, is a dentist for kids and toddler. Pediatric dentistry, endodontics. You know endodontics? Root canal, of course. Okay, so this is one a post. Greatest smile, the dentist, Dr. Allen West Thuban. So come and get care, that the care and attention you deserve. So before you read the passage, talk about the questions. Denise, what are some examples of specialization in dentistry?
We have endodontics, prosthodontics, and pediatric dentistry.
Pediatric dentistry, another specialization that you know?
Periodontics.
Okay, periodontics, yes?
Maxillofacial.
Yes, maxillofacial. Okay, thank you. Jimmy, look up. Prosthodontics. Cuando le ponen los dientes que faltan. Ajá, y los implantes. Jimmy, what do patients do when dentists cannot meet their needs?
Cannot meet.
Their needs. Cuando no cumplen o cuando no pueden resolver sus necesidades.
Maybe they have a complaint. A complaint to the dentist.
No, they make a complaint? No.
No,
I
maybe
mean,
they look for a specialist.
another specialist. Yeah.
Okay, yes.
Because do you
Well,
remember?
it's the second, no? Because
Maybe a referral. A referral.
A referral. Pretty good. Se acordaron la
okay.
palabra. Recuerda que referral es una. Do you remember?
It's a paper and a doctor.
Derivación. Okay.
Yes.
Yes.
Okay.
Okay, no, make a complaint, no sé qué.
No,
Don't
but I
explain
suppose that, no?
complaint.
For example, if I don't have a good service, probably I
Okay.
talk to nurse.
Yes, you can do that. You can do, of course. Totally agree. Totally agree. Yes. Read the web page because there's a web page and choose. Guys, what is the purpose of the web page? This is the web page. You can see here the menu. You can see here the pictures. What is the purpose? To discuss the processing for, to offer biographical details, to provide information about the dental specialties.
What's the process of making reference?
For patients about dentist service.
Yes, services. Okay. Which service is not available at Great Smile?
Oral pathology.
Oral pathology. Okay. Why does Great Smile offer referrals?
Because especially pediatric dentistry, because some services are enabled in.
¿Cuándo ellos ofrecen referrals?
Because they don't perform the root canals, but they don't have. Because they don't have
Services.
No, D.
Up to date. Up to date significa actualizados, modernos.
Okay. Sometimes, ¿no?
No, es B, porque ellos no tienen algunos servicios disponibles. Entonces,
Okay.
los
Yes.
refieren a otro especialista. ¿Se entiende? You got a part? Yep. Unavailable, no disponible. You got it?
Yeah.
Good.
Yes.
Next part. So as you can see here, we have the second part of the web page. Please, Denise, read this part.
Our office is supplied with the most up-to-date equipment. Our dentists have years of experience in general dentistry. They also offer expert knowledge in various specialties.
Continue.
Orthodontics braces are available for adults and children.
Okay, hold on a second. Orthodontics. Orthodontics. ¿Qué viene a ser orthodontics?
Orthodontics.
Ortodoncia para los braces. ¿Qué viene a ser braces?
Brackets.
Los brackets.
Brackets.
Next.
I heard that the guy told us brackets. Did you remember? Did you remember
he
that
said
he
brackets.
didn't know about braces?
Yeah, and I said braces because bracket is this one. These are called brackets.
But
Maybe the reason is because he's studying Spanish and maybe he confused a word.
okay.
Maybe. Okay. Next, endodontics tiene que ver con qué? Con root canals or endodoncia. Periodontics tiene que ver con qué tratamientos for
Related to
Gingivitis.
gingivitis. Gingivitis. Gingivitis. ¿Y la
Gingivitis.
gingivitis con quién está? ¿De qué está relacionada? Related to
Gums.
gums, encías. Prosthodontics viene a ser prosthetics for patient with maxillofacial injuries. Dentures and dental implants are available. Then we have pediatric dentistry. Please read.
Care for infants, toddlers, and young children.
Yes, and then we have oral surgery, wisdom tooth extraction. You know the wisdom tooth, the last one, las muelas del juicio. Pero en inglés wisdom significa sabio.
Ajá.
So ella sería traducida como las muelas de la sabiduría. Okay. Oral in maxillofacial pathology. In radiology, services are unavailable. Mira, radiology, unavailable. So referrals are available for patients who require this service. Ellos te dicen, ya, vete hasta el especialista. A ver, comencemos. Here. So surgery, A, B, C, D, E, F, G, H. The first one goes for Jimmy. Jimmy, you start surgery.
Surgery is management seconds. No. Deal with irregular correction teeth, branch connection with.
Or you can choose whatever you want. Escoge uno que quieras y completas.
Yeah. Dental. I guess it's D.
Number
A branch
one.
of. Uh-huh.
A branch of dentistry dealing with dental pulp. Okay. This is letter D. Nope. What do you think, Denise?
D is for endodontics.
D is for endodontics. Endodontics, yes. Another one?
Okay.
Yes. What about this one?
Correction
Super
of
easy.
teeth.
Super easy. Data and images.
Radiology.
Radiology. Where's radiology? Yeah.
Number 2.
This
G.
is G. This one.
B,
Infants and toddlers.
Pediatric.
Pediatrics dentistry. Okay.
correction of teeth, orthodontics.
Orthodontics. This is B. Then we have health of the gums.
Periodontics.
Periodontics. Missing teeth or tissues?
Orthodontics.
E. Prosthodontics. A branch of dentistry concerned with recognizing and controlling diseases.
Pathology.
Pathology. And this is letter F. Surgery.
Okay, instrumental tech.
Okay, copy the answers. Copy the answers. You finish? You can take a screenshot, of course. Yep. Cool. Next part. Okay, write a word that is similar in meaning to the underlined. Frank needed a surgery for an upper jaw injury. Upper jaw. You know, look at the words E-O-E. Look at here.
Yeah, is
Maxillo, no?
Okay, you say maxillo.
Facial?
Now look at this.
Maxillofacial.
Maxillo, but again,
Facial.
Yes,
you say maxi with
Maxi.
maxillofacial, porque tiene que ver con la maxillofacial with double L. Let's check. De repente nos escribe con double L. Maxillofacial, where is that? Yes, double L. Maxillofacial. Next, all doctors need residency training in a particular field of practice.
Specialty.
Specialty.
Specialty or
Specialty.
specialty? Can you spell it?
Specialty.
Specialty.
Yes.
Yes. Ellen asked her primary care physical for a recommendation.
Advice?
No.
Nope. Cuando te dicen, oye, te voy a mandar con ese doctor.
Reference.
Referral.
Referral.
Yes, referral. Okay, you got that part? Yes. Next part. Listen and read the web page again, which patients require service in prosthodontics. So, si esta persona necesita servicios, services in prosthodontics, ¿qué tipo de servicios va a querer?
Implants, for example.
For example, implants. Implants. Okay, so let's listen.
Great smiles. Dentists, Drs. Alan Westhoven, Mary Engelbart, Eunice Kim. Come get the care and attention.
So why are you interested in joining our...
One
Then I had
second.
my own practice. I do.
Great smiles. Dentists, Drs. Alan Westhoven, Mary Engelbart, Eunice Kim. Come get the care and attention you deserve. Our office is supplied with the most up-to-date equipment. Our dentists have years of experience in general dentistry. They also offer expert knowledge in various specialties. Orthodontics. Braces are available for adults and children. Endodontics. Root canals. Periodontics. Treatment for gingivitis and gum disease. Prosthodontics. Prosthetics for patients with maxillofacial injuries. Dentures and dental implants are available. Pediatric dentistry. Care for infants, toddlers, and young children. Oral surgery. Wisdom tooth extractions, oral/maxillofacial pathology, and radiology services are unavailable. Referrals are available for patients who require these services. Exercises 6 and 7, page 7.
I have a question about your specialties.
Okay.
I have children ages 6 and 12. Do you offer services in pediatric dentistry?
Yes, but I don't work with children. I specialize in endodontics.
Okay, well, I think my 12-year-old son needs braces.
I'm afraid no one here works in orthodontics.
In your ad, I saw that you took care of dental irregularities.
Yes, but in prosthodontics, dentures and implants. No worries, though. I can make a referral.
I'd appreciate that. Thanks.
Okay, that was quite easy. Eso estuvo más fácil. So, which patients require service in prosthodontics? Do you know? Read the webpage. A patient who needs
Implants and crowns and
implants, of course. So now, that question, the man does not specialize in pediatric dentistry, true or false?
True.
Yes, not specialized. He is specialized in...
prosthodont.
Yes, this is true. The woman's daughter needs braces?
Yes.
True. The woman needs a referral to specialist in prosthodontics?
Yes.
No.
Prosthodontics?
No.
Orthodontics.
Or yes. Okay, so we're gonna stop here. And next continue with the listening part which you have to complete. Okay, antes de retirarnos, hemos culminado con eso. Todavía vamos a continuar, Denise. Tenemos aquí Dentistry. ¿Qué parece la lección? ¿Te gusta así la lección?
Yes.
Ok. Ahora le toca a Jimmy. La próxima lección sería para Jimmy. Jimmy,